Okay, we are back. Dr. Rafich from Vet Triage, going through this issue of JAVMA from January 1st, 2016, and we're going to be talking about a paper that comes out of the Veterinary University in California, Davis. Evaluation of the mydriatic effects of topical administration of rocuronium bromide in Hispaniolan Amazon parrots, Amazona ventralis. So the objective is to determine the mydriatic effects of topical rocuronium bromide administration in Hispaniolan Amazon parrots, Amazona ventralis, and to identify any adverse effects. They used 8 healthy adults. Procedure: rocuronium bromide, 20 microliters per eye or 10 mg per ml, or saline, 20 micrograms per liter per eye or 0.9% sodium chloride, was administered to both eyes of each bird with a 26-day washout. Washout means that you don't give anything else to the patient for that amount of time to allow the body to eliminate the medication. 26 days seems like a very long time for this, but whatever, the longer the better, I suppose. Especially if you're not going to have pharmacokinetics involved with your study, then you want to make sure it's a very long time so that nobody can really argue that the medication is still in the body by 26 days, almost a month. Infrared pupillometry and direct pupillary light reflex measurements were attained. Pupillary measurements were recorded before administration and every 20 minutes for 2 hours. After administration, then hourly for a total of 7 hours. Fluorescein staining was performed on each eye for each bird 24 hours after administration. Results found a significant difference in pupillary diameter for the active versus control treatment group from 20 to 360 minutes after drug administration, but not at 420 minutes. Minimal adverse effects were noted. 3 birds had transient inferior eyelid paresis in both eyes. 24 hours after the treatment, there was no difference in ocular measurements existed between the active and control treatments. Conclusion and clinical relevance: results suggest that topical rocuronium bromide administration is safe for pupillary dilation in Amazon parrots and can be used to examine the fundus and for surgery involving the lens and posterior segment in the species. Introduction: the avian iris is composed predominantly of striated muscle fibers. That's important because striated means they have conscientious control over the muscles. With a small but varied component of smooth muscle fibers. Smooth is involuntary control. The predominance of striated muscle in the iris allows for very rapid pupillary excursions and makes parasympathetic agents clinically ineffective. Induction of a deep plane of anesthesia has been reported to produce mydriasis in some avian species. Intracameral injections, meaning in the eye, of both depolarizing and non-depolarizing neuromuscular blocking agents have been used successfully for mydriasis in several avian species. Neuromuscular blocking agents are basically paralytics. They paralyze the muscle, and they are characterized by either depolarizing or non-depolarizing. That's the mechanism of action. Intracameral injections require general anesthesia and can cause damage to structures if not performed properly. Topical ocular use of depolarizing and non-depolarizing neuromuscular blocking agents have been evaluated in conscious birds with various outcomes. Consistent mydriasis has been achieved with rocuronium bromide in a range of avian species. The use of surface-acting penetrating agents prior to topical neuromuscular blocking agent administration did not improve the duration or reliability of mydriasis in several Sicilian species in one study. Topical ocular administration of neuromuscular blocking agents may eliminate the need for general anesthesia, but is not completely without risk. Alcuronium chloride caused temporary complete paralysis of one kestrel, or falcotinunculus, which is a falcon, and was not recommended for use of the authors in that study. Rocuronium bromide is a non-depolarizing neuromuscular blocking agent, rapid onset of action, minimal cardiovascular and histamine-releasing effects in mammals. The duration of action is similar to rocuronium, but the onset is 2 to 3 times faster than that other drug, and it's stable in aqueous solution, unlike other agents such as rocuronium and rocuronium. Rocuronium bromide is successful and safe for mydriasis in several species of birds of prey. Okay, the materials and methods. These birds were 10 to 26 years old. They are unknown sex. The mean body weight was 301.9 grams, are all healthy. They placed rocuronium bromide at 10 mg per ml concentration and saline 0.9% sodium chloride in both eyes. And 20 microliters of either rocuronium bromide or saline to the left eye. After 20-day washout, they repeated the test in the other eye. Pupillary measurement was from infrared pupillometry, was used to assess pupil size without stimulating the pupillary light reflex because the avian eye is non-responsive to infrared light. And you can see a picture here of them with a pipette, placing the medication in the bird's eye, manually restrained with a towel. And then here is the before and after image of the control and medicated. So you can see the top one is dilation of the eye, which is the goal of mydriasis. That's the point of this. And the bottom eye is not responding to the agent. So the top eye there, these are both 100 minutes after topical administration. The top eye is with the rocuronium bromide, the bottom one is with saline. And you can see an obvious difference in the dilation of the eye. Results. There was significant interaction between treatment and measurement time points with significant differences between control, so saline, and the treatment, which is rocuronium bromide, for 20 to 420 minutes. There was a significant difference between eyes, but the difference was small. The predicted mean measurement in the left eye was 4.22 millimeters, and the right eye was 4.28 millimeters. Within the treatment group, significant difference from baseline from minute 20 until minute 360. In the treated birds, there was significant difference between pupillary light reflex scores at time 0 and time 20 minutes through 180 minutes in both eyes. All right, discussion. In the present study, topical administration of this drug effectively induced mydriasis. It started at 20 minutes after application and lasted 360 minutes. The combined dose administration in both eyes in the present study at a median of 1.32 mg per kg was slightly higher than the dose reported in another study of tawny owls that ranged from 0.78 to 1 mg per kg. In previous studies, pupil diameter was measured directly with a pupillary gauge. They used infrared pupillometry here. An advantage of infrared imaging is a lack of pupillary stimulation with additional light intrinsic to the use of either flash photography or light supplied by a transilluminator. An ideal topical mydriatic would have a short onset and duration of action and facilitate complete lens and funding examination as an outpatient procedure or prior to intraocular surgery like with cataract extraction. A significant difference in pupil size was noted 20 minutes after topical rocuronium administration in the study, but the effects persisted for 6 hours. In the Falcon study, the effects were maximum at 90 minutes after administration and lasted 4.5 hours. It may be prudent to ensure that the bird is not exposed to bright ambient light for at least 6 hours after administration. If you ever had your own eyes tested and dilated from your eye doctor, light is very sensitive to you because you're taking your pupils dilated and it can't respond to light because of the medication, so it's very sensitive. Superficial corneal ulceration and ocular irritation were noted in cockatoos in another study where they received topical atropine sulfate and phenylephrine mixed with 1% saponin. Topical administration of pancuronium in a Stissacean species caused systemic effects ranging from mild tachypnea and ataxia to acute collapse 5 minutes after administration, which required immediate intravenous treatment with reversal agent neostigmine. Acute collapse and paralysis have also been reported with topical administration of alcuronium chloride in a kestrel, which is the falcon. There has been 1 acute death from a cockatoo treated with rocuronium mixed with 1% saponin. In conclusion, the topical administration of neuromuscular blocking agents for mydriasis in avian species is minimally invasive and does not require general anesthesia. Using rocuronium bromide was successful for 6 hours in these Amazon parrots with minimal adverse effects. Additional studies are necessary to determine the appropriate dose of topical rocuronium bromide in other avian species, as differences in drug metabolism, corneal uptake, and globe size may cause dosage variability. So yeah, pretty standard study. Obviously, you'd like to have more have to have higher numbers of birds, and it'd be nice to test the pharmacokinetics, plasma or blood tests, serum tests, to see what the actual metabolism is for the drug. Questions like do any comorbidities or previous histories affect the efficacy or the adverse reactions to this drug? If the bird is on any other medications, does it get affected by this drug? And of course, these are normal birds. We don't know what the effects are in birds that have ocular abnormalities. So all these questions are typical, but again, the point of the study was not that. The point of the study was just to establish a baseline, and it did that. It just needs more birds involved. All right, everybody. We'll see you then in the next video. Take care.